We brought him at the station and we charged him. What I know, the OCID is doing his work so that the culprit can be paraded before the court.
What are some of the probable charges?
We have charged him with 2 accounts. One, disobedience of lawful orders. Another one, the second is doing an act of spreading infectious diseases.
Ministry of Works and Transport has re-emphasized that all travel permits will be renewed through the initial organizations that earlier requested for the permits. Speaking at the Uganda Media Center, the spokesperson at the Ministry of Works and Transport, Sarah Kataike, revealed that so far the issuance office has 20,000 travel permits, while the other 40,000 permits are under process.
The Ministry of Works and Transport has cautioned drivers on the need to respect the set guidelines for all motor vehicles on the road and those intending to be on the road to have updated travel permits issued by the ministry to avoid inconveniences. The clarion call seeks to have all vehicles on the road cleared and allowed to move.
If you're cleared, please make sure you don't abuse the use of the clearance, because already we have got complaints where some people are abusing those clearance permits. They are traveling beyond curfew hours. That clearance does not give beyond curfew hours. You work with, whether you drive a government car, if you're not among the 10% that is supposed to be at work, please stay home. The government car does not give you clearance automatically to be on the road.
While addressing the media, Kataike said all travel permits are to be renewed by the ministry following the same process. According to the mouthpiece, over 20,000 travel permits have so far been cleared and over 40,000 are still pending.
The person who applied on your behalf, as I said, Media Center applied for all media houses. So it's the responsibility of Media Center to go back and log into the system. On the day that your permits expire, they log into the system, click on the organization, which is Media Center. When they click, just that click, when they click, it's automatically renewed. So you don't have any issues. So we realized that in some applications, when managers were applying for their organizations, they included board chairs, members of the boards. Those are not essential, honestly. So if where you find that we cleared them, actually now we are going back into the system. We want to make sure that only essential people are on the roads.
All cars, whether branded or not, must have travel permits according to the standing guidelines. The emphasis falls on the heels of arrests of people who are driving on the road with forged organizational stickers.
Whether it's a branded car, but it doesn't have clearance, it's not supposed to be on the road. Because we've had scenarios, police has found where people are using branded cars to actually ferry passengers.
Jane Ramsha, UBC.
Frank Baine, Uganda Prisons spokesperson. Uganda Prison Services have confirmed that they have so far lost 2 inmates to COVID-19 and they have registered over 1,000 recoveries of persons who contracted the novel virus. Uganda Prisons accounts for 1,438 cases on the national COVID-19 statistics chart. Frank Baine, the Uganda Prison spokesperson, breaks down the status of COVID-19 in the prisons.
By this report this morning, we have an accumulated number of cases of COVID-19 as 1,438. Of those, 1,289 are prisoners, 117 are staff, and 31 are staff families or relatives. Fortunately, we have had 1,000 301 recoveries, and in our respective treatment centers, we have 141 cases. In total, we have registered 2 deaths, one of a prisoner and one of a staff family. I have this graph. Those of you who know how statistics you will access, you will see how we have been progressing. I am not the first one, I hope, to use these statistics. How we have been progressing from day one.
Medical workers under the umbrella organization, the Union of Medical Workers in Uganda, are now living in panic over the increasing deaths of health workers contracting COVID-19. Many of those who have succumbed to the disease were on the front line but without protective gear. The Union of Medical Workers now wants government to play its role in protection of medical workers from dying of the COVID-19 pandemic.
Buno bwandibanga bwe buyambi obusookedde ddala guno ogwokubiri gulangirirwa omukulembeze
As the financial year 2020-2021 draws to an end, URA has put measures in place to facilitate taxpayers to file their returns and pay taxes within the set deadline. All our offices across the country and the URA Contact Center shall remain open to provide extra support to our esteemed taxpayers. Additionally, we have extended our contact center service hours from 8 a.m. to 11 p.m. Monday to Friday and from 9 a.m. to 3 p.m. on Saturdays and public holidays. In light of the COVID-19 risks, we encourage taxpayers to reach us through our improved contact center and other online platforms instead of making physical visits to our offices. For online support, please reach us through our toll-free lines 0800 117 000 or 0800 217 000. Email services@ura.go.ug. Website ura.go.ug. Social media: Facebook, URA page, Twitter @URA Uganda. URA Customs Help Tool, help.ura.go.ug/login. URA appreciates all taxpayers who have duly fulfilled their obligations. Stay safe and let us all observe the standard operating procedures to prevent further spread of the COVID-19 virus. Stay safe as we develop Uganda together.
Uganda Revenue Authority, developing Uganda together.
We've cut and reduced our MTN Momo withdrawal rates. Now you can withdraw mobile money at the lowest rates. You also get MTN Central Points when you deposit, send and withdraw MTN mobile money. Visit our Momo agents countrywide and withdraw mobile money at our reduced rates from 1st May 2021. Everywhere you go, MTN.
COVID-19 chijja kugwa. If we get vaccinated now, observe social distancing, wear a mask properly, sanitize or wash our hands with soap and water regularly. Together we can defeat this enemy.
Uganda has the best and most affordable rates when it comes to withdrawing and sending money. Withdraw money for as low as 330 shillings up to a maximum of 12,500 shillings. Sending money is just as affordable as ever. Absolutely unbeatable. Use Airtel Money on the most affordable network with the largest network of Airtel Money branches in Uganda. Dial *185# to get started. Airtel Money. Simple, secure, borderless.
In efforts to improve quality assurance and Uganda's competitiveness as a tourist destination, Uganda Tourism Board is set to undertake a nationwide grading and classification exercise of hotel and accommodation facilities. As a member of the East African community, Uganda subscribes to the East African Grading and Classification Criteria, a system denoted by stars ranging from 1 to 5. The grading and classification exercise will be crowned by the awarding of star ratings to facilities found compliant to the EAC minimum standards. This is therefore a call to all accommodation and facility owners and managers to register and get licensed by UTB as a requirement and get ready for participation. For more information, visit www.utb.go.ug or email qualityassurance@utb.go.ug for details. Uganda Tourism Board, promoting tourism together.
Fellow Ugandans, you know that the current COVID-19 period is a trying time in our lives. However, we still have another threat that has been with us for a long time, and it is called neglected tropical diseases, also known as NTDs. NTDs include bilharzia and worms that cause swollen stomachs. Trachoma causes blindness, and elephantiasis causes the swelling of legs. These diseases are affecting millions globally, and yet they can be prevented by regular hand washing with soap and clean running water, regular washing of the face with a soap and clean running water, keeping dirty hands away from your eyes, always using pit latrines and discouraging open defecation in your community to avoid flies that carry germs, reporting to the health facility early when feeling unwell. Remember to stay safe and protect yourself. This message is from the Ministry of Health with support from a SEN project.
UBC TV News tonight. Welcome back from the break. A section of members of parliament have appealed to government to improve the welfare of persons they describe as frontliners in the fight against the COVID-19 pandemic. The MPs particularly single out health workers, security personnel and media practitioners, calling for adjustment of their remunerations. Led by Kibuku County Member of Parliament, Herbert Chinovere, the legislators call for appropriation of emergency funds for the welfare of frontline workers against contracting the pandemic.
We have noted that health workers who do contract COVID-19 in line of duty, sometimes they are left at their respective workplaces. Hence, most of them have lost their lives. So we are calling upon the government to say that all these health workers, when they contract the COVID in line while on duty, they should be given special attention. This is to ask the government to set up emergency medical evacuation team, including a standby helicopter and ambulances, to ease the evacuation of health workers from across the country who need emergency care in the above facilities. And the above facilities we are talking about is, we are suggesting that the government should establish Bombo Military Hospital and Imbuya Military Hospital to cater for emergency care of the health workers who contract COVID-19 in line of duty.
You find a health worker putting on gloves from morning up to midday. Sometimes they don't change. They need to change even the masks because they are exposed to risks. By last week in our district, Mitoma, we had 11 members of staff or health workers who had tested positive, and this demoralizes even others who are still on the station. So we request that all the health workers be equipped with disposable gowns, enough masks, And even JIC, you find they are lacking JIC. They said, we don't have enough JIC.
So in such a situation, if you were not there at least to give information to the public could have been so much misinformed about this pandemic. And secondly, I want to urge all those who are involved in the motivation of all frontline health workers, they should do what their obligations immediately, including payments of the areas of those who are not yet being paid.
Executive waivers for procurement of COVID-19 commodities. The Ministry of Health should be issued with a standing special waiver under the PPDA Act to fast track the procurement of logistics and to take quick decisions needed during this emergency of this magnitude.
Yes, outside the Compensation Act, the human has a need.
Farmers in Kikorongo Liamibuza villages in Kasese district are suffering losses of their cash crops that were destroyed by a stray elephant which escaped from Queen Elizabeth National Park to human gazetted settlements. The huge elephant roams in gardens, feeding on farm crops and blocking traffic along the Kasese-Mbara highway. Farmers say the stray elephant from Queen Elizabeth protected area has spent over 2 weeks in the community. Ugandan Wildlife Authority has been alerted about this invasion, but the authority has remained tight-lipped about the community's concern about the stray elephant.
The farmers said that the elephant has consumed maize, soybeans, simsim and sorghum, which is their livelihood. Miss Lydia Masika, a farmer in Chikorongo, said that they have spent 2 weeks not accessing their gardens in fear of their lives, saying that the deadly beast has been chasing people from their gardens and nearly killed one of the farmers whom it intercepted in the garden. Accessing the gardens, farmers walk in fear of their lives, trailing the footmarks of the elephant to ascertain its movements and then sneak into the farms. Many of the female farmers here, to be on the safe side, often seek for company of their husbands or hunters to their farms. The local council chairman Chikorongo village, Kule Doviko, said that he has reported to UWA but with no response from the authority to have the elephant back to the national park.
Namasema to the police, nabarana be police, a police mo to kebe kodako, namana ngre police shanga to kirungu chishambude ka bingenzo namo iko kwa uwa. Nabiringa iko kwa uwa bamwe mbokale wesinja ba uwa mubaterera abenanga ba uwa mubaterera abantu abera abantu bamwe bakiasi babingenzo. So rwe mbakiasi babingenzo namunabwire sebala batamengayo sibe singo kubakesha korai. Na echabirinde mesha enzo yeso kwa hende eshabirunza walinga mahika ngabe kumenga bisatu bya abantu banamulera. So
this community is prone to elephant crossings every season, but the farmers here are hardly compensated whenever they register losses of their crops at the hands of elusive elephants that have escaped from the protected holding grounds of Queen Elizabeth National Park. UWA last year erected an electrical fence to deter animals like elephants from crossing to community settlement areas to avoid animal-human life conflict, but the investment has not solved the problem. Elephants that are cunning animals sense the powered fence and trace their way out at locations that are not yet fenced, which remains a challenge to UWA.
The Medical Workers Under the umbrella organization, the Union of Medical Workers in Uganda are now living in panic over the increasing numbers of deaths among health workers who have contracted the COVID-19. Many of those who have succumbed to the disease were on the front line, but without protective gear. The union now wants government to play their role in protection of health workers from dying of the deadly virus.
According to Medical Workers Union, over 2,000 health workers in government hospitals have contracted COVID-19 since its outbreak in the country in March last year. Although some health workers have survived death in the process of treating and after contracting the disease, some have not escaped the death of COVID-19. It's against this backdrop that Medical Workers Union has called upon government to play its role in protecting health workers from losing and contracting COVID-19 in the process of saving other Ugandans.
Without PPEs, health workers cannot provide quality routine health service because they live in fear of contracting the disease.
And just losing one doctor, one nurse, and others, to train them is not easy.
Because these are undiagnosed cases. Patients walk in with signs and symptoms, but because they are not diagnosed, these health workers are in contact with these patients.
Dr. Sanya Agre, the General Secretary, Medical Workers Union, says, whereas most of health workers have not been provided with health gears to use in the health facilities, some have resorted to abandoning their roles towards patients, hence causing death.
We borrowed enough money. Government should put up a big plant around either Namamve so that it can produce enough oxygen. When such demands come, we have enough cylinders to support the small plants in regional referral hospitals. All health workers deserve allowance, irrespective of whether they serve in COVID-19 treatment units or not.
When you go up country, you find that some people stay in the ward for more than 8 hours. Now, when you stay for 8 hours, most likely you can contract the what? The disease, because the more you stay in an environment where it's contaminated, the more risky it becomes, the more vulnerable you become.
Without eliminating the scarcity of oxygen in the country, they also want government to set up reserve isolation space for health workers at every regional referral hospital to help in treating health workers who have contracted COVID-19.
We also ask the government to create a special place for these medical workers. Once they fall sick, they don't put you where you have been treating people and you have been seeing people dying. That alone can also cause more deaths to the health workers.
Wilson Yowetha, Chairman, National Organization of Trade Union NOTU, called upon Minister of Health to use the donated funds and for COVID-19 in the right way. However, he called for increase in manpower in health facilities.
I'm requesting our members of parliament to follow up and monitor that the money meant for COVID is actually used for COVID. We want to see all the doctors, the nurses, all medical workers with the proper protective gears.
Abudubia Katonda, Workers Member of Parliament, says it's high time government to organize and put more emphasis in the health sector.
So this implies that we are ill prepared in all aspects, something which can actually bring a positive danger. And yet these are things that can actually be done through proper planning. And the government has all these dockets that can actually ensure that, for example, when you are talking of disaster, there is disaster preparedness. When you are talking of appropriation, there is parliament. When you are talking of ill health, the Minister of Health is available.
Deborah Namamonde, Ivan Juko, UBC News.
The rehabilitation of the 67-year-old Kazenga Channel Bridge that developed cracks has started in Kasese, but it has slowed business, hence igniting controversies among the business class in the area. Though UNRA has provided a ferry to ease the crossing of people and goods on either sides of Kasese and Rubirizi districts, has not stopped fastened the traffic due to the small size of the ferry that was provided.
The ill-fated bridge was constructed in 1954 by the colonial government to link the landlocked present Kasese district to the rest of the British protectorate, as well as King Leopold mineral-endowed Zaire, presently Democratic Republic of Congo. The bridge now is 67 years old and no longer friendly for usage. Uganda National Roads Authority has swung into action and it has stopped road users from using the bridge, but it has provided a ferry as an interim solution to ease the movement of people and goods. Here, drivers of lighter vehicles and passengers that are allowed to use the ferry on Kazinga Channel to cross to and from Kasese district have asked government to provide a second ferry to enable quick access to either sides of the water channel. This follows a temporary closure of the 67-year-old bridge that had developed serious defaults in 2019 and has since then been identified as a death trap.
You just find there are so many vehicles. You wait for almost 3 to 4 hours. Now, like me, I used to take this chicken, and when I delay on the road, others die from the road.
Engineer Solomon Aimbisiwe of Dynacol Limited, the company contracted to facelift the bridge, says his company has been contracted to remove the old dilapidated bridge deck and replace the rusted steel connection metals at a cost of 898 million shillings. He said the rehabilitation works on the bridge will take less than 4 months.
So our scope of works includes replacement of very damaged panels, concrete panels, and refurbishment of some of the steel sections and connections as well. The duration of the project is estimated to last 3 months, in which we hope we'll have finished the replacement of the concrete panels, the refurbishment of the steel sections. In that time, we think we'll have finished the repairs.
The Katunguru Bridge is very vital for both business and security of Uganda as a country, since it links Uganda to the Democratic Republic of Congo and many other COMESA countries.
The services of the ferry, much as they are there, you'd expect some hiccups from the traffic because there are waiting times, as you can observe on either of the landings. Then you find that the heavy goods vehicles have been diverted to detour routes. For them, they can't be loaded on the ferry. So the ferry has been provided for the passengers, the pedestrians, with the saloon vehicles and those small light goods vehicles.
The bridge also serves as a transit route for the local communities to deliver food and other commodities like salt from Katwe Salt Lake to the rest of the country. Here, many food transporters are seen scrambling for space on the ferry to cross and access markets on time. Meanwhile, local communities are asking the Health Ministry to step up COVID-19 standard operating procedures, since there is congestion that can lead to infections. Dennis Sigor for UBC News.
Lawyers representing suspects in the attempted murder of General Edward Katumba Wamala have filed an habeas corpus in the High Court Civil Division, where they want all the 8 suspects who were arrested to be produced before court with immediate effect. One of the lawyers to the arrested assailants, Geoffrey Turiamsima, says since the arrest of their clients, the lawyers and relatives have been denied access to these people.
In the home of this guy.
During a presser last week, police through its deputy IGP Major Gen Paul Rokech confirmed the arrest of 5 suspects following the attempted murder of General Edward Katumba Wamala, the killing of his daughter Brenda Nantongo, and driver Aruna Kayondo. Since their arrest and detention in police custody, the accused have not been arraigned in court. for pre-taking or trial, following the expiry of 48 hours in police custody as indicated in the Constitution. The legal team representing suspects in the attempted murder of General Edward Katumba Wamala have filed an habeas corpus to produce the accused in courts of law.
Now, we found it relevant yesterday and indeed today that we filed this application for habeas corpus in order for their bodies, whether alive or dead, to be presented to court. And the good thing that court has given us tomorrow at exactly 9 a.m. to appear before Justice Philip Odochi so that we can proceed with our application.
This case has been filed against the Attorney General, Deputy Inspector General of Police, Commandant Special Investigations Directorate, and Chieftains of Military Intelligence.
Some of them we hear yet to confirm that have been killed or murdered in the course of the investigations. 2, the time has already lapsed for the 48 hours for them to be taken to court. 3, their families, together with us, the lawyers, we have been blocked from accessing them from wherever they are.
Lawyers also accuse security operatives for killing the alleged suspects during the process of arrest, saying it is not allowed in the law and the rights of fair hearing against an accused person.
It's unfortunate that we have heard even some rumors that some have been killed. But let police or Attorney General come to court and present the same report to court. That during this period, they have arrested this number of people and they have killed this number of people, and because of this reason. That's what we need. 2, at the same time, for their families to access the bodies of those who are alive or those who are dead.
The 8 suspects who have filed the application include Kamadawa Lusimbi, Muhammad Kagugube, Sirimani Kisambira, Hussein Wahabu Ruwama, Mustafa Kawa Ramadhan, Juma Saidi, Serada Idris Elias Tataumal. General Edward Katumba Wamala was shot at on 1st June 2021, though his daughter Brenna Nantong and driver Haruna Kayondo did not escape the death during the assassination. In another development, High Court Civil Division, before Judge Philip Odochi, has issued a certificate of urgency to SEDU in the case they filed against the Minister of Health and government over the hiked prices of COVID-19 treatment in private hospitals.
The case in nature is urgent, like court has agreed that it requires the intervention of all the respondents to intervene in this period when the medical fees for treatment and management of COVID-19 patients are exorbitantly high. So the court agreed with us and said indeed it is true. We need to intervene. So the case is fixed for hearing, and then we shall await the orders of the court as to whether it agrees with us or not.
In giving this order, Judge Philip Odochi indicated the date when the case will come for hearing and also directed the applicant to serve all the respondents in this matter before closure of business today.
The main case will be heard on 8th July at 9 a.m. His Lordship has also directed that we serve the Attorney General, the Minister, and the third respondent today, by close of business today, such that they can file their affidavits in reply by 7th of July.
Following the hiked prices of COVID-19 treatment in private hospitals, Moses Mulumba and Sehad dragged the Attorney General, Minister of Health, Medical and Dental Practitioners Council in courts of law. Deborah Namamonde, Ivan Juko, UBC News.
Thank you so much for watching. That is what we had for you at this particular time. Let's get back to you at 10 p.m. with a bigger arrangement. My name is Michael Jordan Lukoma with Elizabeth Nakakoni. Wish you the best. Enjoy the next program. Catch you at 10.
Если ты думаешь, что ты особенный, и то, что вас не коснется пандемии, вы глубоко заблуждаетесь.
Емкость мозга ограничена, куда более гуманно тела складываются в рефрижератор.